So one of the questions I often am asked is, how do you choose whether to do a big incision or a small incision? And how do you choose between one small incision or two small incisions or the robot or no robot? Which minimally invasive approach is right for me and why should I do minimally invasive approaches? I tend to like a minimally invasive approach whenever possible. I believe that a faster recovery is a good thing. I find that in some patients, minimally invasive surgery is actually easier than a traditional surgery because even though we're using small instruments or long chopsticks to do the surgery, if you will, when we have someone who is maybe more heavy set, who many people think of as not a good candidate for minimally invasive surgery, I find it is easier to do the surgery because we're not having to work through a thickened abdominal wall. So one of the questions I'm always asked is, am I too heavy for minimally invasive surgery? And the answer is actually you may be a better candidate. You may have less risk of wound issues that you are at increased risk for, like infection. You may have less risk of bleeding, and we may actually have better visualization and better ability to do the surgery minimally invasively. How do we decide between one incision versus three incisions versus a robot versus no robot? I tend to like single incision laparoscopic surgery. And I'll be honest, I started doing single incision laparoscopic surgery because I thought it would be more cosmetically appealing. It is called nearly scarless surgery because we hide our incision on the inside edge of the belly button so that as it heals, it looks like the normal wrinkles of the belly button rather than a scar. So it is nearly invisible in most patients. I like it because I found that those patients who I started doing that in had dramatically less pain. And people will talk about vaginal surgery for hysterectomies versus laparoscopic surgery versus laparoscopic assisted vaginal hysterectomy. I found that the laparoscopic approach tends to have less pain. And I have my own thought processes behind this, why this is. A vaginal surgery is a great surgery for the right patient. However, to do vaginal surgery, we're operating through a 9 to 10 centimeter long canal that has a 3 to 5 centimeter opening and taking something else at the top of it that's 9 to 10 centimeters, if it's an average size, out. And so you can imagine that it's hard to operate through a tube to take out something like that.